work session to study the request from the county for a mental health proposal from Lakeview Health District. And Charlie has been doing considerable research on it, so I think we can turn it over to you, Charlie, to bring us up to date. And then we did have Jane with quite a bit of former experience, which would be nice to hear.
Well, at our last meeting, when we became aware of the RFP request, you asked me to prepare a response to the RFP, and then you would discuss it. Sorry, I don't have a completed RFP. I'm a little hard. But we still have up until June 10 to get the application. So we've been gathering a lot of different information and trying to understand, number one, if it makes sense for the district to do, and then if so, how would we go about doing it? So I apologize for I am continually gathering information about in order to respond to the request. So one of the things that we have in front of you is the actual RFP. This is it itself. And it is due on June 10 with anticipated start date of July 1. A very short window to respond to. In going through the list of issues, we talked to the county, and they provided us a fair amount of information. Some of it as recently as this afternoon, so it keeps coming. We provided for you, we can go over their financial statement. I think we gave you a copy of how the county prepared it, but what this report that Cheryl prepared is, rather than break out the way the county does it, which is, everyone have a copy of that?
Yeah,
Okay.
this one? This is the brown one, the one the county did is this one.
Right.
But you didn't get a
Is this the one
copy
you're
of that.
looking at, Charlie?
No, not that one. It's the
Okay.
one that your left hand is on. That one right there.
Oh,
Is this the one you're referring
That's
to?
ours.
Yes, okay,
I
yes.
thought this was Lake District. This is the county. This is
So-
Lake District, right?
It is
That's a
prepared
summary.
by us, but it is the budget from the county put in a different format.
Oh.
So what we
This is
did
actually
was,
the county budget.
it's the county expenses for the last, since 2012, and then it takes the budget, but rather than separate it out as the county does, one portion by mental health, one portion by alcohol and drug, and one portion by prevention, we lump them all together. Just because it's easier to look at. And again, we're trying to figure out, is this something that the district wants to get involved in? So I think getting a broader picture is more important than trying to
Break out the segments.
break out all the segments initially. So that if you...
Again, 3 different segments in the county?
Yes.
Okay.
And the reason why it's separated like that is partly because of the Oregon statutes, through the ORSs. It breaks that out. So the funding comes in those different categories. And so it's easier for the county to track the expenses and the issues by those segments because that matches with the ORS categories. And so we keep monies in the right compartments. Okay? So again, what we want to talk about is what are the broad brush approaches and how would we address this if this is something you want that we respond to. So what the county does is it signs an agreement with the state of Oregon. This is that agreement. It's called an intergovernmental agreement. And it's for financing of community addictions and mental health services. Every county is responsible for this document.
Is that annually?
It's a 2-year agreement.
2-year, okay.
And so one of the requirements of the contractor, should that be the district, is that we would have complied with this. So the way we would envision, the county cannot dissolve itself of this responsibility, but it can assign the responsibility to another organization. Up until now, the county has been responsible and then has tried to provide that service. Okay? So, this is a pretty in-depth document. Not all the things that are in here are being done in the county. A lot of things are sent elsewhere. So patients are leaving the county for some of the services. And then the county does as much of it as it's been able to do.
Who's the current provider for them, Charlie?
The county.
They're doing it themselves.
It is a department of the county. Lake County is to my knowledge, is the last county in the state of Oregon that is, the county is operating this. All other counties have contracted with other organizations.
But no other hospitals.
No other hospital, right?
All right.
Well, remember, we're looking at this as a district, not as the hospital.
Okay, gotcha.
Okay, so in almost every other case, in every other case, it is mental health services delivered by a private nonprofit organization, or in some cases for-profit. But it is another organization that contracts with the county to deliver that service. Okay? So, as the county looks at who might submit a response to this, it could come from a variety of different places. Could come from Klamath. The mental health services that's delivered in Klamath County could come from other organizations, possibly one in Burns, possibly one, the same organization that's providing consulting services out of Hefner could submit an application. Okay. If we look at the requirements of the RFP, you have to work within this budget. The county already adopted the budget, and you, Cheryl can talk a little bit about some of the items on that if you want. What it also says is that all assets must be, so all the money must be used in Lake County, and any dollars that are part of the mental health budget can only be used for mental health services. You can't use it to transfer to another department. The district could not use it for anything else. And at no time would we do that. We'd honor the, and that's stipulated in the IGA. So there's no question about how those dollars are used. A big part of this is what are the contractor's capabilities. So if we were to do this, clearly we're not in the mental health business. We'd have to either hire or take some time to become qualified to do that. So we would not be coming in as meeting all the existing requirements. And so that in itself is a gift. Getting all the certifications, all the licensures, we either have to hire the people to deliver that, or we'd have to, as an organization, become licensed and meet all those criteria.
Do they meet all the criteria right now?
No.
Okay, that's what I thought. Okay.
But the money in the budget that they have would be used to do that, all of those things.
That's correct. And when we look at the budget and what was actually spent last year, so the budget for going forward as next year, as well as the monies that they have spent year to date, it would appear that there's adequate monies to deliver that service. A big problem has been, can they hire people? And right now, they're short of people. So are they able to deliver all that service? One of the ways that they are delivering, the county is delivering that, is that the county is contracted with a company called CCS, Community
Care Services.
Community Solutions. Community Care Solutions. Kimberly Lindsay is the name of the CEO of that organization. Thad is an employee of that organization, as is Chris O'Line, who is the current on-site manager.
They currently handle 4 counties. besides us.
That's correct. And so what they're doing right now is, in between bed and pods having left, the county has to be able to deliver this service. They contracted with this organization to take care of those things right now. One of those, for example, is weekend crisis call service. If somebody in the county has a crisis, there has to be somebody, the county is responsible to respond to that crisis. Whether it's in Christmas Valley or here, whether it occurs in a home or the client is brought to the hospital. And they need to be able to address that. So that's currently how that service is being delivered. It's on the county's contract to support that service. Some of that is being done by existing staff, but where they don't have enough staff, that's what, CCS is doing. Okay?
I might comment that Kimberly had got involved in the discussion with her, and her biggest issue was that we need to hire somebody completely qualified, certified as the director. Need a good, experienced director. And that, she didn't, I gathered that she didn't think that we had that in the past. And we have to spend more money to do it, and she pointed out that counties are reluctant to spend that kind of money.
Is that type of person available? I guess in my mind, there's a real disconnect here. We see all these concerns, yet they have some money. Where's the disconnect? I mean, why hasn't the county been able to hire that person that would be so, that you think we can hire, that could do this?
I can only speculate. Looking back, why the county hasn't done that, I think the county commissioners who are responsible for overseeing this are overwhelmed with a lot of issues.
And they are.
They have roads to deal with, they have all sorts of issues, and they all take a lot of time. And frankly, it's just difficult to pay attention to. And nothing against our commissioners, but they don't necessarily have the expertise in mental health. And that's one of the reasons why, the principal reason why, most other counties have contracted with somebody else to do this. It's a complicated business, it is not easy, it's demanding, and the demands on their time are tremendous. And this takes a lot of energy.
I think probably similar to the Alturas County supervisors trying to take care of the Alturas Hospital.
And that was one of the last hospitals in the United States where the county was still operating the hospital. In almost every other community, counties that had a hospital formed a district, just like they did in California, as like we did here, and have the district responsible for it. You know how much time and energy it takes for you not only to pay attention to the intricacies of the hospital, but then have the consistency and the forethought to understand and focus on this business. You don't have to worry about roads or economic development or public works of other kinds. And so it's hard to do. That's the only reason I can think of.
Maybe I'm getting ahead of everything, but I'm just have all these questions in my mind. But if we were to decide to follow through with the RFP, could they delay the takeover time to give us the time to hire, if we were to get the award, if you will, to hire a manager that would take on and that you would not have to deal with any of this?
Well, the answer, I think, would be the county would be willing to do that. At least in some of my conversations with some of the commissioners, they've said, we might be willing to do that. But one of the challenges we get into is if we start recruiting for somebody, who do they work for? The county or the district. If we find somebody that's a good person, we hire them into the county, then they wait 90 days to get their benefits. If after a month later, when we find a manager, now we have to make them wait another 90 days to get their benefits with us, it makes the process go slower. And people will say, well, I'll wait till you hire a manager before I take the job.
I don't think that's what you were saying, is it?
No, I don't think that's what it's.
But I think the big concern we all have is that we don't overload you, Charlie.
Right. Well, so one of the things that the county has done is contracted with CCS to essentially provide that on-site and oversight directorship, and they're paying them a fee for that.
I think what I heard Judy say was that, say, we asked the county to extend our contract to July, so that we maybe have somebody, so that we can maybe have somebody start August 1, gives us time to advertise or whatever.
Wage
Have
transfers
somebody
in
in
September 1 or
place.
something.
And so they never do work for the director never does work for the county. They start August 1, working here.
So what I did is I went to CCS and said, would you, were the county to award us the agreement, would you have the same agreement and contract with the district?
Oh, cool, yeah, that works too.
That's what I was getting to. And what they said is yes. In fact, what they said is, I said, what happens if we can't hire them by September 1? Because that's the term that they're saying you have to be licensed and meet all these criteria by September 1. So what happens if we can't? Or we find the right person, but they can't start until August 31st? Would you be willing to extend that beyond that? And we are in discussion. What they said is, we're committed to help Lakeview through this issue.
The commissioner said that.
No, CCS.
Oh, CCS said that.
That's the organization that's currently providing that advice. That's Kimberly, Lindsay, and Chris Oldwine. And what Kimberly really said was, it isn't up to me, because I physically can't be here. It would be up to Chris. Because Chris is physically here. Chris lives in Washington, just north of the Dalles. And he has come down here to help out. He's an employee of CCS, but he's here physically. The contract calls for his expenses and housing and that sort of thing. And he gets a fee for that, his salary. So the important part for me was, if they would be willing to extend that contract, instead of contract with the county, if they contracted with us, and extend that however long it takes, then we wouldn't be under the barrel to try and find somebody immediately.
Charlie, did you get any indication from them if they would be submitting a proposal, CCS?
What Kimberly has said is that she can't speak for her board because she still has to go to her board. But she has said, I cannot physically work in 4 counties, especially Lake County, that's 6 hours away from where I live. I physically cannot do that. And I am not inclined to submit an application or a response to the RFP. That doesn't mean they won't.
Right, okay.
But, and I didn't ask her to,
No.
but rather, what is your expectation? And would you be willing to extend an agreement? And she verbally said, I think so. It would be based on Chris. I've been talking to Chris, not extensively, but enough to see if we could work together, if that would be something that he'd be willing to do. He has a couple of resumes. I have a resume right now that he interviewed, but I haven't pursued that. Because I didn't want to presuppose what what you think we ought to be doing. Because I think that's a little bit getting out there. My goal is to respond to what you think, and whether or not we could do do this without,
How much time do you think it will take you to be involved in this?
Can I answer what Kimberly told you? Remember, she said, you asked that question, and she said, maybe 5 hours a week in the beginning.
part of that is how much oversight do I have to do?
Right.
What we would probably need to do to meet the in order to meet these requirements from the state, there are two evaluation bodies that we have to work through. And they have two different sets of requirements, but they're very similar. One is what Gobi requires to meet the CCO requirements. And the other is the state, which meets these requirements. There's some overlap, but there are some that are not. So, as an example, the state requires that you have sex offenders and battered and court-ordered therapies. That's not necessarily in the purview of the CCO. So there are different requirements for different skill sets. In order to get the responses to each of those, Chris believes we would need virtually a full-time administrative assistant to help in preparing the policies and procedures, getting them formatted. There's lots of application material that would have to happen. So how much of my time would that take? Probably more of an assistant to help us. We could clone Jen or something to that effect to prepare those documents. How long that would take? They're estimating it'll take, well, nobody knows. If you remember Kimberly saying there hasn't been an application prepared in any county in the state of Oregon recently, a new one. So they think if everything got all lined up, it may just take a couple of months. But nobody knows for sure. So I have arranged a conference call with Gobi to talk about from their standpoint, and we're working on it from the state, trying to get an idea of what the demands will be, how much time that will take. I can't
And this
answer.
administrative assistant would be a district hire?
Well, if we were to do this, and now the mental health responsibility is a district responsibility, we would use the mental health funds to pay for that component. So
They do have a reserve, so you got $1 million reserve right now.
For mental health, okay, I see that.
Yes.
Yeah.
This would be under the district, but it would be a separate organization with its own ID number, correct? In other words, kind of like Lakeview Gardens, our rural health clinic, mental health.
well, there's a couple answers to that, and we're pursuing those. As far as we can tell, there are 3 possible scenarios of how that would fit under the district. One is that we form a separate entity, like a home health agency has its own ID and a wholly owned organization that is owned by the district. Second thing is there's a possibility that it could be treated as a clinic of the district, of the hospital. So it could be like a specialty clinic. And then the third option that we can think of so far is that it would be considered an extension of our rural health clinic. So as we look at the 3 possible options that we are aware of, we have engaged a conversation with a state Oregon Health Authority, past or previous Oregon Health Authority expert and their firm to determine if we could do any of those. We've been asked Whitley, our auditors, if they will, and they're talking to the state, could it be treated as a clinic? Could it be treated under the Oregon Health, under the Rural Health Clinic? And so each one has different implications in terms of the reimbursement. So we don't have a clear answer yet, or hope we would. We expect to have a clear answer before we respond to the RFP. But we've asked several people to help us in that process.
Now, in that, each one of those scenarios, we would get enhance revenue over and above what they budgeted for?
Under two of them.
Under two of them, okay.
So if it was treated as a clinic of the district, then we would get cost-based reimbursement. And it would be the same as the mix that we have in the hospital, Medicaid, Medicare, private insurance, that kind of mix. If it was in the rural health clinic, we would get the payment from Gobi for the Medicaid, for the CCO patients. We would, as part of the rural health clinic, get Medicare payments, and then we would get a matching wraparound payment that comes from the state as part of a rural health clinic, enhanced reimbursement. And then because it is provider-based, which is owned by the district, we don't have a cap on the cost. So our cost would be covered by Medicare and Medicaid.
But that goes into a mental health budget, correct?
It all goes into a mental health budget, that's correct. All dollars as part of mental health services that specifically are coming from the state have to be in that budget. Those patients that come to us that are private insurance, that doesn't have to be into that budget. Because that's not state contract. Okay? Under the other scenario where we form a separate organization that has its own license, but is still a wholly owned subsidiary of the district, then there wouldn't be that enhanced reimbursement. It would be just like any other business that the district owned.
And Charlie, the mental health would continue to be housed where it is currently?
Well, because when the county bought that building, it was used with mental health dollars. So were we to take on the contract, the building would be transferred to this organization. Let's use it just for the sake of ease, that we formed a separate company. It was ABC Company, owned by the district. It's a nonprofit ABC company. So the building would be, the value, the building itself would be transferred to ABC Company. If we wanted to continue there, we could. If we wanted to relocate, we could. But the building belongs to the district, or to ABC Company, excuse me. Okay? If we wanted to push the building over because the location is a wonderful place and build a new building on its spot, that would, I mean, we have lots of options of what we do with the building. There have been suggestions that we consider having two locations, one for adults, one for children. Because right now, it's not exactly a positive environment for when you have both mixed together. There's a variety of different options. We don't physically have a place right now that we can house the service on our campus here. There has been talk that maybe one of the better things that could happen, should we take on this responsibility, is to build a building here and include that on our campus so that we take away some of the stigma often associated with mental health service, let alone county mental health service. So when we think about some of the pros and cons of this, certainly a con is a lot of work. On the pro side, we would have an incredible opportunity to integrate physical health, mental health, and we could deliver a far better service. That is certainly one of the goals of Medicare and CMS. It's a goal of the state. There's a lot of interest in, and there's a fair amount of grant money available to try and integrate mental health and physical health. Because it's clearly known that where you have siloed health services, you don't deliver good comprehensive care. So we could do a lot better, after all, work for our community. but it's just whether we want to take on the challenge.
Not a big question, but if you take over their employees, they're on a PERS system, what happens to their PERS system?
Well, there are several things that we would look at with that. So I have a list of all the employees, and a list of what their categories are, and all of the employees are in the union that contracts with the county. So as part of the RFP, the county asks, how are you going to handle that? There's a concern about transfer of public employees. Talking with our attorney, we would go through the process of, there would be a separation of their employees from the county, and they would have to be employed by the new entity, whether it's ABC company or the district.
How many employees do they currently have, Charlie?
8.
And how many would they have at full staff?
I asked Chris that question, and he estimated as a minimum they should have 10 to 12, not including a manager, as a minimum. But one of the challenges that they have faced is it's unfair to point fingers, but it appears that one of the challenges they've had is they've hired a manager and a clinician at the same time. And you need to have a manager who understands the business and then hire clinicians. It's too big of a business to have somebody try to do both. And so it would be my expectation that we would hire somebody to be in charge of this.
And you think that with an increase in salary, I think we talked about this earlier, you think those people are out there to hire?
It's not easy. There's no doubt about it. Gobi is actively looking for, all throughout Eastern Oregon, for, well, they're advertising for positions throughout Eastern Oregon. No, it's not an easy position. They're not easy position to fill. But that being said, there are people that are still being hired. No, I don't, at no time, I hope you don't hear that I think that this is just going to be a walk in the park. And this is an easy, solvable problem. We would be taking on a lot of work and a lot of challenge.
And that concerns me. That really concerns me. I just don't see how, in this case, because we don't have a COO at the moment, that you have the time to do that.
I agree. Listen, I stay up nights thinking about this. Is this something I really want us to take on? Because frankly, it'll be a lot on my shoulders.
Of course it will.
On the other hand, I'm passionate about what we do in our community. And I think that if we really think about who, aside from taking care of our community, I have a personal strong desire to help our physicians. And mental health services, when it isn't functioning well, is an enormous draw and drain on our physicians. It is difficult for them, they're challenged by it. They see the individuals that have crises, they see and do things that are harmful to themselves or to others. They deal with this just in a different way. And if we really want to work to support our physicians, this is something that really impacts them in more ways than others. And so I think by helping solve this problem, we actually not only help the community, but we help our physicians. That's one of the reasons why we hired Tara Jones as an LCSW. When we put the position out there to hire an LCSW, it was absolutely focused on helping our doctors to deal with patients that come to them that need to have care, that weren't getting it anywhere else. And we're fortunate to have hired Tara. She's a fabulous therapist. She's providing super services. And she hasn't been seeing any CCO patients since she's been hired by us. Maybe one or two just recently. What that tells me is she's been busy seeing people that haven't been addressed, that have not been taken care of.
And I understand that concept. I totally understand that concept. But that doesn't mean that somebody else who might write an RFP here might be able to offer that same service in this community to our physicians. If it's run well and if it's, you know, if it, oh man, this is tough.
Well,
I don't think that mental health is well served by an entity outside of our community. I've seen that over and over and over again.
Oh, I've certainly seen that since I've been in this community.
Since 1979, there's been lots of turnover.
Yeah.
It's been horrific.
I think we're uniquely situated to be able to do this, except for time for Charlie. We need a bridge, the time between, if we were to take this on, to the time it's fully integrated with a proper manager and clinicians in place.
And I can buy that. I absolutely can agree to that too. I think that is what we need.
I frankly wouldn't think about this if we didn't have that bridge. And while I
But
don't.
you're not sure we can do that with the way the RFP is.
Oh, no, we absolutely can. What I don't have in writing from Kimberly, who's the CEO of CCS, is the contract. She said when I talked to her on Monday that she would send it to me. And I just don't have that in hand. I talked to Chris just before, maybe an hour, 2 hours ago, and he said that he had no, from when we talked on Monday until today, he knew of no reason why they would not want to continue doing this. There have been no changes. He's just busy taking care of clients and dealing with the issues. He continues to be very interested in Lake County and supporting this process. So before we even move forward on this, I would want to have an agreement in writing. So that, because otherwise, we couldn't. We don't have the clinical or the physical capability of doing something.
When I read that RFP, Charlie, we don't even meet most of those requirements.
Well, remember, we're not in the mental health
I
business.
understand. That's
So the
right.
question is, how quickly can we become adept at doing that? And the answer is we have to hire the right people.
Right, exactly.
That's right.
Exactly.
We do.
Yeah.
That's right.
So,
That's what gets us.
Total key
Well-
right there.
Yeah.
so I have at least one resume who is, and I remember we're in a public session, so I can't talk about individuals. But this individual, amongst a couple that we've talked to, is interested and very capable. We haven't gone the next step to start the conversation, but that's what I would do. And one of the things that I would also do is I would engage the expertise of headhunters, of recruitment companies. It's expensive, but as you have seen, when we look at we've used extensively a recruitment firm in our physical therapy services. It's been expensive, but we have a very robust, good program. We have good staff, and sometimes you have to pay to find the right people. We got fair wages in the deal, but we pay the firm to find them for us. That's what I would do, and I wouldn't fiddle around. That's how I would approach it.
Well, I think we all are in the same situation. We don't want to hurt what we've got by taking on another load.
that to hire somebody this year.
Well, I have some thoughts about that.
Well, let's hear them.
And the answer to that is, toying with the concept of having a chief clinical officer. And we have,
Chief clinical officer? Different than the COO?
hear me out. So what a chief clinical officer is,
Go ahead.
what a chief clinical officer would be responsible for is nursing and some of the other radiology, lab, rehab, those clinical services. That takes a fair amount of my time, takes time that I would give that responsibility to a COO. And if you took somebody internally, we could maybe find and we might be able to move people up within the organization. It's still under consideration. Some organizations have done that in a variety of different ways. But that doesn't mean we don't, part of that will be determined based on, we've got a couple things that we are, as you know, working on, some of the development things that we're focusing on. If we found the right person, and potentially at least one of the candidates we've looked at on paper or have talked to, who's strong enough to head up this, it wouldn't take a lot of time.
Did you just morph back into mental health?
I did.
So this clinical manager is in lieu of a COO?
Not necessarily in lieu, but that's something we might want to talk about in executive session. I can talk more.
Charlie, you've done this to us before. Yeah, we might want to talk about this in executive session.
But I hear what you're saying.
Well, have we got anything further to discuss? Are we in agreement with Charlie proceeding with the RFP response?
I am.
Well, I'm reluctant, but I will go along with the board because as long as we can get a manager
Qualified person.
and get somebody to relieve you of whatever duties you may have as soon as absolutely possible.
I hear what you're saying.
Don't grin at us like that, Charlie. I know exactly what's going through your mind. That's not for the paper.
Open session.
Gerald, didn't hear a comment from you?
No, and for me, the key is that individual. Everything is dependent really upon that. I've got a list of questions here that is for my own, but it really doesn't matter if you don't have that key person to hire and in place then.
What are the kind of questions maybe we could address? Some?
Well, I'm kind of wondering about the north end, how that ties in with what we're doing. So then all of a sudden, here we have an off-campus, is the facility adequate, transportation, some of those kind of things. But I don't worry about, I think those need to be addressed, but
There's a couple.
only if, yeah.
So in terms of transportation, the county has purchased 2 vehicles with mental health dollars. That comes with the agreement. So there is assets to go to the north end. Number 2, the facility I can't speak to because I haven't seen it, but I am told that we have an excellent there is an excellent therapist in North Lake. We also have, some of the therapists from here have been going there. And how often, I don't know all the details on that. But there's probably no doubt, there's a fair amount of shoring up that would need to be done to enhance the services that we were delivering. But again, when we look at the dollars, we look at the budget, and Cheryl prepared this, I mean, there's, didn't prepare it, but massaged it to help us.
Well, there's, obviously, they budgeted for a lot of growth, for a lot of hiring. There's a lot of money that they're not spending.
Yeah.
Yeah, there's a lot they're not spending, which is actually concerning, really.
It's kind of weird.
Yeah.
What it says to me is, we need to be doing more for our community. We have the ability to do that. We have the ability to hire people. Is that gonna mean that we don't add somebody else in our physical, in our HR department to do more hiring? I don't wanna keep adding people. Every time I turn around, it seems like we're adding people. But if we have to, we're gonna have to shore up what is not being delivered.
You have to be
do that
aggressive,
quickly.
yeah.
And we have to be aggressive. And this is not something we can say, well, we'll do it in 6 months. Well, it's something you'd have to get after right away.
You know, we have to be aggressive, but we have to be effective. And that means hiring the right people who can do the job. And not just add another person because this person isn't quite qualified and, well, you know the story.
And, you know, just because we hire somebody out front, they look really good, there's no guarantee it's gonna be perfect. We've had that experience before. We like to think that we make good choices, but sometimes we don't, in who we hire. So we use a lot of people to help us in that process.
There's one issue in there, that this is, we need to realize, a 5-year contract with the county. So once we put our foot in the water, we're in there.
That's right. And you did say before, you were reluctant to consider much more than a couple of years. But this is a longer-term commitment.
And it needs to be, really. I mean, if you're
Yeah.
gonna do it, you
Well,
need to
you
do it.
probably really don't know your effectiveness in a
Right.
short period of time.
Kimberly did point out that after 6 or 8 months, you'll be wanting to add services.
You know, one of the things that.
That's right up your alley, Charlie.
There certainly are some pretty serious concerns on that.
And it's necessary services, necessary.
In that organization.
Well, we can talk about that more in executive session, because I don't think that there's need to air concerns like
Sure.
that. I shared that with you just to give you an idea of what we would be looking at. And heaven knows that we barely know much about this. This is just toe in the water. There'd be lots more to find out. But I am told that there are a lot of really good staff members that are in the individuals in the mental health department, and that with good coaching and good direction, they would be exceptional. That they care about their clients. In mental health world, they talk about clients, not patients. So we would use different language in this process. And there would be many different things. It would be a steep learning curve for us to help you learn more about it. We'd have to gear up on some of our portions of it. But a lot of it we already know about, or we know how to run a business. And we could do that.
Do they have an advisory board?
They do.
Yes.
They have. Unfortunately, the advisory board hasn't been quite as active as it should have been. Ken Landau used to be our representative that was on that committee.
I think they're about 3 members short too,
Yeah.
in different categories, so they're not where they should be or want to be in the different categories.
I can tell you that I have been personally approached by some of the members of that committee who have encouraged us to submit a response. They are.
Now, I understand that that's a requirement, the advisory board.
Oh, my Lord, yes.
Is that because it's a county entity? It's because it's a mental health entity, and it would remain the same whether it became part of our district?
Absolutely. It is a requirement as part of the intergovernmental agreement.
Oh, okay.
And that says you need to have community input when you're providing this kind of service. And we would want to have that. We would want to have that, and we would go out and solicit individuals to participate in the
There's some good
bonds.
people already
Oh,
on
yes,
there. Yeah.
but to enhance that,
Mhm.
so that we do get,
Yeah, there's several vacancies.
is again, community support, community involvement. That was one of the things I would expect that the director would spend a lot of time on. I would do my part to participate, but again, I don't have a lot of time to dedicate to another adventure.
Yeah, we're gonna watch the committees you join. You've got a lot of commitments.
Well, I think it's important that
Yes.
the committees the ones that I get involved are ones where I think that it is important to represent Lake County. It's important to represent independent district hospitals and critical access hospitals. I think our voice needs to be heard on a state level. I don't think it's worth my time to spend it on a national level, because there are plenty of other people that can do that. But in the state of Oregon, I think it's important for Lake County for us to be.
And we support you in that, and I think that's our request for the COO issue too, just so you have that.
I hear you loud and clear.
Mhm.
I would suggest we close our meeting. We'll finish this in our board meeting, whatever day that is, third or something like
Next Thursday, a week from today.
that. Yeah.
Are we having a finance meeting?
It's Tuesday
Uh,
instead of Monday.
Yes.
Finance meeting is on Tuesday, is that correct? or-
Tuesday at noon, correct?
Okay,
Not Monday at noon.
I could be the money.
I'd prefer not to, thank you.
Okay.
I'm putting up fencing.
Meeting is closed. Thank you very much.